Good morning, good afternoon, good evening, wherever you might be. Just a brief update on my progress so far. It's just about a year since I had my surgery for OPLL, and I think I'm doing a little bit better these days. Coordination, balance better, strength better. Some of those fine motor skills are coming back. The only thing that is a constant irritant is numbness, hands and feet. And the numbness in the lower portion of my body extends all the way up to my knees. But I suppose I should be grateful in that I'm actually getting sensation. Sometimes it's actually unpleasant to pick stuff up, and it's like the neuropathy that people get if they're diabetic or they have after chemo, that kind of stuff. I imagine it's similar to that, touch something and a little twinge from time to time. But the good thing about it is I can actually feel stuff. I don't feel I'm at risk of slicing my fingers off when I'm cutting up vegetables or doing other sort of chores around the house. So that's the good news. Weakness, still plenty of weakness. I'm not back to my pre-OPLL days, so there's a little bit of strengthening, but I think the fact that my spinal cord can sort of swim free in the cervical area means that signals are getting down to the nether parts of myself, and hopefully my brain will start telling me to start building some muscle up in the arms, legs and hands and feet. So that's where I am for now, and I think it's good news. I don't know if it's just a good idea to join a Facebook group for fellow sufferers, but I did. And one of the people there actually said, well, after 1 year you're still healing. So they were at the 2.5 year mark, and they reckon they're about as good as they're going to get. And it might be I'm never going to be back to having normal sensations in hands and feet, because there might be some permanent cord damage, because my cord was compressed to 2 mil, which is pretty small. That's for benefit of the American audience. 2 millimeters is pretty tiny, bearing in mind that the spinal cord in the cervical area should be about 15 mil, so there was a lot of squidging there. So I think generally it's onwards and upwards. I get a constant reminder that I did have some major surgery about a year ago, but it's not really, like I said, it's a lot worse for some people. I've never really had much in the way of residual pain, except for the weeks after the surgery, where me and Oxy were great friends. Now I get the occasional stiff neck, ache in the neck that goes, and still get the creaking that I had before. So I guess might have something to do with being 71 years old, that bits of me creak, so that might have nothing to do with anything in particular. So anyway, if you're watching, thanks. If you like this, like it. If you want to comment, please comment. Well, just even if there's somebody watching, it would be nice just to say, I actually saw your video, because I don't get that many likes, follows and lookies. So again, thanks again for everybody, and if you're seeing this, and I'll sign off, and hopefully later on I will, in a month or two's time, I can do another little update as to how things are going. So it's so bye. Well, it's bye if I can actually press the button that says stop. So I'll try again. One thing about this spinal stuff is the fingers aren't very good at pressing buttons yet, but I'm getting much better. I can actually button up my own shirt if I don't have to use a sort of a buttonholer device. So again, I will try and say goodbye for the second time, and as they say, I'll be back.